Start your mornings right with the Medicare Morning Show. Join our dynamic trio of hosts, John Davis, William Lacey, and Felicia Evans, as they bring you the latest insights, expert advice, and real-life stories to help you navigate the world of Medicare.
Happy Monday, everyone, and welcome to the Medicare Morning Show. I am your host, John Davis, and I'm here with the amazing lifetime learner, Miss Felicia Evans. Welcome to the Medicare Morning Show this morning, Fee. Where are you at? Welcome to the show. We are back. I do the same intro every week, but we're back, Medicare Morning Show, here every Monday morning at 10 a.m. to discuss all things Medicare, giving you news that you can use, including community health and, most of all, Medicare education. Thank you so much for joining me, y'all. Today, we got a packed show, Felicia. We got so much to cover. We got a packed show.
So I'm ready, though. I'm ready, and our viewers should be ready, too, because this is major.
Y'all should be ready. Because remember last week, guys, we talked about Medicare Parts A and B. Well, today, we're going to talk about Medicare Part D, as in prescription drugs. We have a guest speaker here, Miss Sherry Bagwell from Devoted Healthcare. She's going to give us news we can use regarding Medicare Part D. Of course, also, we're going to give you all Beyond Bingo things to do this week in the city. Felicia's going to have that. But before we jump into bringing Sherry onto the show, Felicia, I think you have some breaking news that we need to share with the people. So let's get straight into that this morning.
All right. Y'all ready? All right, this just in. As of January of 2024, 412,844 residents in Tennessee have been disenrolled from Medicaid. It's called Medicaid unwinding, and it's because of the renewal process. COVID had a lot of people not renewing, but this year it has started to happen again, and people are not receiving their letters, and if they have, they're not paying attention to them. So what's been happening is that people are losing Medicaid every day. So get those letters. Ask questions to your agents that you have to support you in this, because it's getting really, really serious, because disenrollment is happening for Medicare recipients.
So listen, Fee, that's truly breaking news, because I've had so many of my clients that are receiving TennCare, QMB, SLMB. If you know what these abbreviations stand for, you probably either have it or work with someone that does. A lot of people are losing those determinations, and they're losing and having to pay their co-pays and deductibles for their medical services. Of course, Fee, there's two different programs. When we think about Medicare, we think about TennCare or QMB, SLMB, but then we also think about the low-income subsidy program for people that need help paying for prescriptions. This program doesn't, or your breaking news doesn't affect the cost of Medicaid of prescriptions, because it's the LIS program, but the TennCare program, QMB, SLMB, that does affect many of our clients' ability to go to the doctor without having a copay and paying the $174 out of their check for their Part B premium. So it's
it's very, very crucial that when those letters come in this year, you have to really look at them, read them. If you don't understand them, reach out to your agent, because you're going to have to reapply for it. And they're going to ask for income verification. That's key to keeping that coverage. And a lot of people have been used to in the last 4 years since COVID, not having to do that. And then now all of a sudden it's kicking back in real quick. Quick.
So thank you for delivering that news, Fee. And by the way, I like your hat. It fits you perfectly. So look, guys, remember I told you we have a guest speaker on, Sherry Bagwell, to talk to us about Medicare Part D, as in David. But before we bring her on, I wanted to go ahead and share, Felicia, some information with our listeners on what Medicare Part D is, what it covers, and then that way when we get Sherry on, we'll just talk about the deep changes that's happening for Medicare Part D going into 2025. What do we have on Medicare Part D today, Felicia?
All right, let's go pull this up. I can show it for you. So with Medicare Part D, the key points covers prescriptions, right? So you have different prescription drugs that you have, either generic or your brand. And it actually has a list of drug coverage. So if you actually have a certain plan, right, you would look at that formulary of those lists of drugs that is covered. And that's what Medicare Part D kicks in. Now, the key is what, y'all? Having Part A and B. You must have Part A and Part B, and they are organized into tiers. So you'll know more about that according to your plan and according to, what you have, right? Now let's talk about these penalties, because Miss Sherry is going to talk about penalties, but she's not going to get nitty gritty into it. But the penalties for late enrollment, so meaning you have to enroll in Part D to not have to pay late penalties. I don't care if you don't get sick. We're going to ask those questions later. The late penalty is at 1% of your premium, okay, times the month that you don't have it. So I'm going to break down the math in just a moment. So 1% seems small, right? Like, it don't matter. 1% don't matter, but it's times however many months you did not have that coverage. So let's do the math. Right. All right. So the example right here under the bottom of the prescription drug pills is, okay, say for instance, you go without coverage for 24 months. Okay. So at 24 months is times that 1% times whatever your Part D premium is. So let's give an example of $34.70. So yes, $8.33 is small, but guess what? The $8.33 is added back into the $34.70. So it's not just, I just paid this $8. No, you're paying that plus your premium every month. And that doesn't go away.
That's what I was about to say, Fee. The thing is, it's $8 and whatever cent. What was it? $8.33 for the rest of your life. So it's really important that to those of you that have Medicare or Medicare Part B, and you have not went out and gotten a prescription drug plan, it's important that we do so now, whether you need it or not. Some of those prescription drug plans are extreme fee, was maybe $10 a month, and it's going to cover the basics of the medication. That will save you from having to pay a penalty in the future. So think about that. It's something that we all need to consider.
Yeah.
So, Fee, without further ado, I want to go ahead and bring in Miss Sherry Bagwell. Again, y'all, Sherry's from Devoted Healthcare. Fee, you want to stop me?
I want to stop you right
What
there.
You got?
Because Miss Sherry may cover some stuff that people may not understand. Just two things real quick. Okay. The first one called donut hole. Now, we're not talking about Krispy Kreme.
Okay.
We're not talking about Krispy Kreme.
I would love a Krispy Kreme donut on this beautiful Monday morning. I'm just saying.
Not Krispy Kreme. But a little quick definition of what a donut hole is when she talks about it is basically a temporary limit on what Medicare Part D prescription drug plans will cover. So when it doesn't cover something, what does that mean? It comes out your pocket. Okay.
That's right.
So that donut hole is the missing piece of the donut that you have to pay for. The round part of the donut is what your Medicare pays for. Okay.
That's it. I like that.
And one of the new changes is going to be what's called, what is it, MP3?
MP3 program.
Right. So it's what it stands for is Medicare Prescription Payment Plan. That's why they got the 3 Ps. And so yes, you'll break that down, but yes, a payment plan will be added into the new changes for 2025. But I just want to cover that real quick. So when they go in with knowledgeable, that's what we
absolutely, Fee. And we need knowledge. And Sherry's gonna come with a lot of knowledge. So let's go ahead and bring her in. Y'all, Sherry Bagwell.
All right.
Okay, so Sherry, thank you so much for joining the Medicare Morning Show. We're glad to have you. Fee?
Yes, we are. And I'm ready for this information that we're about to give to our viewers. Let's go.
Yeah, so Sherry, you were listening. We were just talking about the Medicare Part D and the changes that's all happened to Medicare Part D. Of course, we just started our series on the basics of Medicare. So last week we spoke about the different parts of Medicare Part A and B. And now we need to speak to someone, an expert about Medicare Part D. And that's why you are here. So welcome to the show, Sherry. And
Thank
believe
you
it or
so
not,
much, John.
yes, ma'am. And think about Sherry's our first guest. So welcome to our show and being our first guest. Clap it up, clap it up. so,
This
so
is such an honor. Thank you, John and Felicia, for having me this morning. So good morning, good morning.
good morning.
And a lot of people think that Medicare's not an exciting topic, but I know with the two of you, it has been exciting. So we're going to keep this excitement rolling. So,
That's the plan.
That's right. And we're going to do it. So Part D. So Part D, is a A and B, because A and B comes for red, white, and blue card.
Yeah.
And Part D is D as in drugs. It's going to cover the cost of your prescription drugs. And it actually is offered through private insurance companies. So a little bit different from Medicare, but it's something that we all need. It is required that you get Part D if you don't have some type of credible coverage, because if you don't get a Part D, then you get a late enrollment penalty. Right. And none of us want a late enrollment penalty.
Exactly. And Felicia, I know you talked about that in our earlier session about the late enrollment penalties. And then Sherry, you said something else about being penalized if we don't have Medicare Part D. So I think we've already established that Medicare Part D is a requirement, or you're going to get penalized after having Medicare Part A and or B for 63 days, Sherry, without having coverage.
Yes, John, that's correct. You can go 63 days before you pick your Part D plan. If once you've lost your credible coverage.
Okay. So a lot of our listeners usually either age into Medicare or they've been entitled for their Medicare Part A and B because of maybe a disability. So for our listeners that's currently working, you want to work till you're 70 or 68 and you recently retired. Once you get when you say entitled to Part A and B, Sherry, does that mean once they receive their red, white, and blue card and it has both the A and the B on it, are they required to have Part D at that point, or is it some other time that the 63 days start?
So once you get your red, white, and blue card, you can have only Part A or only Part B. And with either one of those designations, then that is when the Centers for Medicare and Medicaid say that you are required to pick up Part D. However, if you have credible coverage, let's say through your union or through your employer group, then you do not have to pick up. But once you no longer have credible coverage, then you have 63 days to pick up your Part D through it's going to help us take care of our prescription drug cost.
Okay.
So I have a question.
Yes.
If I am at 63, but I choose to keep work, I don't want to work. I'm retired, or 65 and I retire. But I don't get sick a lot. Right now, I just take my herbs. I take my CMOS, right? Do I still have to get the Part D? Because I don't really take meds now.
Wow.
So you are required. If you don't pick up a Part D, let's say you just go with your Part A and B because you've retired and you feel like you don't need drug coverage, then there will probably become a time in your life where you're going to need a prescription drug. And in order to obtain that prescription drug at a reduced cost, then you would be subject to a late enrollment penalty because you didn't pick up that coverage when you first was eligible for it. So does that make sense?
That makes sense. So just have it just in case. It's kind of like a just in case. So I won't be penalized, and just in case I may have to have a prescription when I'm 70, 80.
I'm not going to be sick ever. I'm going to live forever, and when I die, I'm just going to die and never take a medication. But that's hugely unlikely. See, don't laugh at me, but it's unlikely. So, I've seen so many of my clients, or some of my clients, who went years without a Medicare Part D plan because they felt like you, Fee, that they didn't need it because they don't take any medication. They take vitamin A, B, and C, and that's it, and they don't need anything else. But then now they may be 90 years old, and they get on a medication after a surgery or something, and they have a hard time affording it because they never had a plan. And now to get a plan, they're going to be given their late enrollment penalty. So that's a big deal.
Okay.
Yes, and something else to think about, Felicia. If you're very, very healthy and you live such a healthy lifestyle, we have to remember. Let's say you go out and you're running a trail or out there exercising, and all of a sudden you sprain your ankle, and you're going to need an anti-inflammatory for that injury, so that as soon as you're eligible. So it's not always just about our medical side, but it also helps protect us in the event of accidents. And trust me, when you get my age, you'll find that tripping and flipping comes pretty easy. So if only the gymnastic people could see me now. So.
Right. So Sherry, I know we've talked about this going into 2025. It's really important that we understand the changes that's happening with our prescription drug plans. And, I've read the changes, I've looked at them. I don't think it's that horrible of a change. We all have changes every year. But can you just talk about some of the changes that's happening? I know we have a max out of pocket of $2,000 this year. Maybe even the 5% catastrophic coverage amount that we've had to pay in 2024 is going away. But there are several other changes, and I know you're the person to talk about them. So what's the changes for 2025 on Medicare Part D, Sherry?
Okay, so you're right, John. We are going to have changes for 2025 that start January the 1st, 2025. But the reason why we got to talk about it now and we got to look at it now, because we want to pick the right plan for ourselves for 2025. And in order to do that, we've got to understand the changes. So, for example, guys, what's happened is right now in 2024, we have 4 stages to the Part D drug design. We have a deductible stage, we have an initial coverage stage, and then stage 3 is the donut hole stage. And I was going to bring donut holes today to show you how the donut hole is leaving, but I was going to eat those. So that's the other reason I didn't bring them. But anyway, so the donut hole, or the coverage gap, it's going to go away for 2025. So yes, that's good news. And then stage, so that's what we are faced with this year in 2024. So any of my friends and colleagues and that's out there listening, if you're in the donut hole right now, the real donut hole where you have a coverage gap, these changes for 2025 is going to excite you. And let me tell you why. Even though John stole my sparkle just a little bit, so for 2025, we are going to have a $2,000 maximum out-of-pocket cap. So that means when you reach $2,000, your maximum out of pocket for 2025 reaches $2,000, then you're done. You'll pay nothing else, and your insurance company is going to pick up the rest. So let's talk about so we're going to 3 stages for 2025. Our first stage is the deductible stage. The deductible stage is where members would pay the full cost of their drug until meeting the deductible. Okay. Now, stage 2 is called the initial coverage stage. And this is where members pay their copay or their cost share for their prescriptions until their maximum out of pocket reaches $2,000. Now, here's some more good news. that the cost that goes towards your maximum out of pocket is the greater of what you pay or the amount you would have paid in a defined standard plan. So we can do some math in just a moment.
Okay.
And then stage 3, the catastrophic stage, that sounds so intimidating. But
it sounds catastrophic.
That's right. That's right. But what this means is for our Medicare beneficiaries, it means they're done. They don't pay anything else. They're done. That's right. They sit back, they go get their prescriptions at $0. There's no 5%. There's no this, no that. Catastrophic coverage. You made it.
Well, Fee, Fee, that is definitely breaking news. That's something that you should have broke. That's something that should have broke the internet, that going into next year, there is no more coverage gap, donut hole. So a lot of those people share that we're used to seeing that are used to mid-year having to pay out of pocket goes away going into January, right?
That's right. That's why I said all of our friends and people tuning in today that are in that coverage gap, this is wonderful news for them. Okay. So I'm very excited for them. I have a sister-in-law. She's in the coverage gap right now. I need to call her and say, hey, next year we can do something about this. Yeah. So let me tell you. I'm out of pocket is basically a new term and something new that none of us have really dealt with before. And I think that's why no one's been talking about it. But now is the time for us to educate our friends, neighbors, family, and anyone that's a Medicare beneficiary, because this is important. Because saying what goes against your maximum out of pocket doesn't always mean that's what you're going to pay. So let's look at this. So for example, let's say with most all Part D plans, you have at least 5 tiers, okay? 5 tiers. And so let's say that you have a tier 1 drug and the cost of that tier 1 drug is $10. But the plan your customer is on says that your tier 1 drugs is 0. Because normally that is the cost for tier 1 drugs is 0. So the amount that goes towards that maximum out of pocket is the cost of the drug, $10. Even though Miss Sally didn't have to pay $10, she still gets that credit of the $10. So then let's say that let's look at a tier 2 drug. A tier 2 drug, and just to make the math easy, let's say this drug costs $20. So with this $20 drug, Miss Sally's cost for a tier 2 is $10. So you would think that only $10 would go towards her maximum out of pocket, but no. The full cost of that drug, once again, is going to go towards her maximum out of pocket. So all of a sudden, her tier 1 and tier 2 drug, it's put $30 into that bucket. That's her maximum out of pocket bucket. So even though Miss Sally has only paid $10. So when I say that the $2,000 cap is a good thing, I mean, it can really be a good thing, because we're going to have a lot of customers that hit the $2,000 maximum out of pocket that will not pay $2,000. So you see why I get so excited. Yeah. I've been at this so long, guys. I just get excited. I know Medicare's not exciting, but when we can save people money, John and I go way back. And if we can save people money, John knows how I am. I used to have access to John's calendar. I'd be like, John, can't you get over there by 2 o'clock tomorrow? And he's thinking, no, I already got somebody at 11, 12, 1:30, and she wants me to drive over there at 2. But I'd be like, oh no, we got to go help Miss Sally. So, but anyway, so that's why I'm so excited.
Yeah, that's awesome. So Sherry, Felicia, what were you going to ask? I know you had a question. I saw your hand.
Yeah, with those changes as it relates to the donut hole for our current clients, right, who has that, is there something that they need to do, we need to do to go in and maybe change their plan to get it, or it automatically goes into effect what they currently have?
So what I highly recommend for all of our Medicare beneficiaries, so even all of our Medicare beneficiaries, come October the 1st, they can start shopping plans. But they are going to receive in the mail by September 30th at the latest. They're going to receive in the mail by September 30th at the latest an annual notice of change. Most people will receive 2 letters, one about their drugs and one about their other medical benefits. It's going to change for plan year 2025. Now, with most of us, when we get those annual notice of change, we think, oh, that's going to give me, I want to go through those 4 pages, and they put it to the side. But this year, we've got to read it. And all the really gung-ho, good people, brokers that we have and agents, they're probably already reaching out to their customers to say, please read your annual notice of change this year so that we know what's going to be changing. And a lot of the companies, a lot of the insurance companies right now are notifying their customers that are in the donut hole right now, the coverage gap. They're sending them letters saying, fear not, come 2025, there's going to be a change. And what that change is all about is, instead of you going into the coverage gap, we're going to have a payment plan that you can actually use. And that payment plan, our friends at the Center for Medicare and Medicaid, they named this the Medicare Prescription Payment Plan, MPPP. That's a lot of.
I see Fee's hat moving. Fee, what do you got? What do you got, Fee?
I love a good payment plan. I miss my Kmart. Okay, that's how much I used to lay it away. You feel Christmas. Okay, so you mean to tell me, Sherry, that if I have $1,000 prescription, I got to come out of pocket in the beginning, right? That I don't have to pay the $1,000 up front. I can do the MPPPPP.
Yes. And what we're going to do to make everyone's life easier, we're going to call it the M3P. Because
M3P.
That's right. Because yes, M3P. Because how many of us can say MPPPP fast or over and over and over? We'll be so tongue-tied, our customers will be thinking, gotta use the bathroom. And we don't want to think that, because the M3P is a very good program, and it'll be offered by all insurance carriers. So what this is, it doesn't change how and so, and program participation is totally optional. And like I say, I do feel that most people in the donut hole, they're going to benefit from this. Now, a lot of us get Part D subsidy. And so those people probably won't benefit, because the government has already found a way to make their drug costs lower. So if a beneficiary chooses to participate in the M3P, they are going to receive a notice with their annual membership card that tells them a little bit about the M3 program and what it's about. And our jobs as agents and brokers is to let our customers know that this is available, so that's right. So Miss Sally, that $1,000 drug that you're looking at that you might pay for, you don't. Because what we can do, your company can set you up on the plan. And then years are to go by that tells her how much. And so when she goes to the drugstore, she'll simply just go and pick up her meds, and she would pay her insurance company for that drug, not the drugstore. So it's kind of nice, and we can spread that over 12 months. But like I say, participation is optional, and she can join at any time. Maybe she thinks, well, I've got the money to pay for this $400 drug. And then something happens and she wants to get stuff for the grandkids. So she goes, well, maybe I don't want to pay $400 again. So that way she could call her carrier and say, hey, help me with this M3P. but those notices will be in the evidence of coverage that your customers receive, and they'll be receiving information from their insurance carrier on how they can simply call in, mail in their applications to get this started. And it's not based on credit rating or any of that stuff.
Okay.
You automatically qualify
Okay.
as long as you have a Part D plan. So
Okay.
it's very nice. It helps you to balance your money just a little bit better. So
Oh yeah.
now,
Sherry, you just got so much information. We just can't get enough.
it is so much information, but
Yeah.
it's all good information. And John, maybe with you and Felicia at a later time, we could actually get some screenshots of some payment plan works and maybe
Yeah.
do a session on how the M3P really works so people can get a full grasp of it.
Oh,
Now,
yeah.
something that I think is very important for us to bring up is that, we have a lot of people out there on insulin. And one of the things that I think is great, because I don't know, y'all are maybe too young to remember when people would go to the drugstore and insulin could cost them $100 for a 30-day supply. Sometime it was more than that.
Wow.
It'd be terrible. And, you would hear of people having to share insulin because they couldn't afford insulin. Well, one of the things that we have now in place is that as long as your insulin is covered by your Part D drug, you cannot be charged any more than $35 for a 30-day supply.
Wow.
So that's wonderful. And
Yeah.
that way, all of our friends that are on insulin should be able to afford this. And what's even more is that that even goes for insulin that you get through an insulin pump.
Okay.
So $35 for a 30-day supply, that's great. And also, the same thing applies to vaccines. So with vaccines, your members are going to pay $0 through all stages for vaccines. So that's great because and that also applies to Part B vaccines, like your shingle vaccine and that type of thing. So to me, that is one of the most exciting things, that we're going to pay no more than $35 for insulin, and we're going to have zero cost share on our vaccines.
Okay.
The only caveat is we've just got to make sure that your insulin is covered by your Part D insurance company. So that's why it's so important. We had talked about the annual notice of change, and CMS requires that everyone get one, and your customers are going to get one, your family, your friends. So around September 30th, we need to be saying, hey, did you get your annual notice of change? We need to call our customers. We might need to have some seminars available so that we can talk about this in detail, because your annual notice of change is going to tell you if there's a change in your Part D premiums, your Part C premiums, the deductible. Because let me say this, with the drug cap going to $2,000, what we are going to see is that a lot of insurance companies, because they are taking on so much more of the cost, then that cost has to go somewhere. So what we may see is drugs changing on tiers, drugs coming off formularies. So people need to shop. This is the year where we need to shop. So because prescription formulary or tier changes will be in their annual notice of change.
Okay. Yeah, and we've talked about that. I think last week on the episode feed, maybe we mentioned the annual notice of changes and how they're coming out. Most customers and most people don't read them. And then when January comes, February comes, we go to the pharmacy expecting to get our medication. This is one of those years where we want to make sure we check out those notice of changes so that we'll know what to expect. So, because there's so many changes with Medicare coming into 2025. So, Sherry, you've been amazing as always. And I know the thing about this show is it's only 30 minutes, 30 to 40 minutes. So we can't cover every little piece.
Right.
But we do have, I know URs and things like that going on in Nashville. I'm working on some seminars. Felicia, I know you have some coming up starting in the middle of September. So it's plenty of opportunities where people should go out and learn and investigate the changes that's happening for 2022. But Sherry, I know you're a busy working lady and it's open enrollment. And I know that you got a bunch of other things to do. So I want to tell you thank you so much for joining us today and giving your insight. Um, and we'll have you back here. I would say next week, but production may not allow it. Who's
Well, you guys are wonderful. Thank you, John. And thank you, Felicia, so much for having me on today. And I hope that we've given everyone enough information that at least I think the most important thing is because the 2025 changes to Part D, everyone needs to shop their plans. They need to understand what's going to happen before we go to the drugstore in January and say, what do you mean, Mr. Pharmacist? What do you mean I got to pay $50? I've been paying $5 for that. So we just want to prepare everyone because no one likes those kind of surprises.
Right. That's true.
Thank y'all so much. I love what you're doing for our Medicare beneficiaries. It's great to see y'all out there educating people because that's what it's all about. So thanks again for having me on today.
Thanks, Sherry. We'll talk to you soon. Thank you for joining the Medicare Morning Show.
Okay. Y'all have a great day.
Oh, wow. That was deep.
Yeah. It was
That was
deep.
deep.
Sherry's good. Sherry, thank you so much for joining us. We had tons of information. It's so much to cover. And the thing is, Fee, like this is only a 30 to 40 minute show, so we can't cover everything. But this is definitely the MP3 program we want to talk about.
Yeah.
The late enrollment penalty is something we need to follow back up on.
Yes.
How to choose your prescription drug plan with the formulary and all of that other stuff. These are topics that we're going to cover in the future. So y'all stay tuned to get more information.
But if the thing about it is, yes, it's a lot of information, but guess what? When you have an agent that you can reach out to and talk to and they give you your personal touch to kind of break this down even more, then you can do that. Yeah. Reach out to your agent to be able to help you because, again, these changes are coming and coming fast. But, your agent can help you understand a little bit better based off of your needs to help you change the plans. But it's going to be a lot of changes. It's going to really take effect. But you have to be ready for it. And you only be geared up by the agent that you have. So get geared up. And start calling them, texting them, emailing them.
Absolutely.
For appointments and meetings.
Felicia, we got to let everybody know we do have our website up now. It's MedicareMorningShow.com. You can go there. You can send us comments. You can send us questions. You can watch it a little later. But Felicia, it is now time for us to usher our listeners out into the week. But before we go, we do not want to play bingo. So what else do we got coming up this week beyond bingo? What we got?
Beyond bingo. So here we go, guys. So when it comes to Beyond Bingo this week, we have a National Museum of African American Music, downtown Broadway. I would suggest doing an Uber down there because parking is a little expensive. 510 Broadway, Nashville, Tennessee. Their hours are from 10 a.m. to 5, and their admission is $24.95. So get down there if you haven't visited before. If you have, go back. It is amazing the things that you will see and learn. And also Dial Down Diabetes. Say that 3 times fast. Dial Down Diabetes Lifestyle Management Program. Dial. It's going to be September the 12th. So that's actually next week at 10:30 to 12. And Matthew Walker, go visit Matthew Walker. The address is there, 1035 14th Avenue North. Well, they're going to be basically, I guess, we're giving testing for diabetes. Is that how we work?
No, it's a program where you come, you learn about diabetes. If you are diabetic or pre-diabetic or have a spouse, husband, or friend that may suffer from diabetes, it's a perfect program to go and just learn how you can advocate and help them through their diabetic journeys. So go check it out. I believe the host this week is Tracy Henderson over at Matthew Walker Health Center. Y'all know where that is in North Nashville. So, All right, guys. So as always, we want to thank you guys for watching the Medicare Morning Show. It's been our honor and pleasure to usher you out into this week to go live a vibrant, fun, and happy life. I'll see you again on next Monday at 10 a.m. for the Medicare Morning Show. Thank you so much for joining, Fee, and listeners. Y'all have a good day.
See you later.
All right.